Munchausen Syndrome is the topic for this video. Munchausen Syndrome, by definition, is the intentional production of physical symptoms to assume the sick role. So what's happening here? Well, a typical scenario is a person basically fakes symptoms and goes to a hospital, let's say an ER, says to the doctor that he has this and this and that, and then the doctor runs all these tests, all the tests are normal. Then the patient's discharged, he goes to another hospital, maybe a few days or a few weeks later, same story. And patient hops from physician to physician, hospital to hospital, explore why this is happening and what this is all about. Well, keep in mind, these are not really symptoms. I mean, they're fake symptoms. Have any of these, he or she is faking. It could be anything, but there's a long list. I mean, there's vomiting, blood, hematemesis. The patient can say that he or she is coughing up blood, diarrhea, anything really, pain, fever, and one thing that's important, that a lot of people that do this are quite knowledgeable about medical practices. So their profession, sometimes they could be a nurse or maybe even a physician themselves, because they need to know how do you give yourself a fever, how do you give yourself some of these symptoms, and that comes up a lot in licensing exams. Now, this is actually listed as a psychiatric mental health problem, so that's an important thing to remember. When it's all said and done, it's really a mental health issue. Now, it's important, before we rush into diagnosis and test and all that, let's talk a little bit about the history, about what's going on with this patient. Many times there's a long history of emotional difficulties, and really it's a psychiatric issue, because there's nothing actually wrong physically with the patient. It's a mental health problem. Also, there might be a history of emotional or physical abuse in the past. The adult might be someone who was severely ill during their childhood. That's something that could also be part of their history. Unstable relationships, that's something that could be part of the history as well. Also, what is the purpose of doing all this? Why is the person faking these symptoms? Are they trying to get something? Is there some secondary gain? And the answer is no secondary gain. Because if there was, by definition, that would be malingering. All right, I write that on. That's a different disorder. Malingering is when somebody has secondary gain. But if there's no secondary gain, it's Munchausen. Their only motivation really is just to assume the sick role. Now, you might say, well, why are they trying to assume the sick role? Well, this has been sort of investigated and explored, and a lot of it is just medical. It's difficult to understand a lot of times why, but perhaps they feel that they can protect their self-esteem by blaming, problems on their illness, or it sounds weird, but maybe they like being associated with lots of physicians or medical centers or things like that. So it's obviously a psychiatric problem. So then, how do you diagnose this? Well, there is nothing to diagnose. I mean, in terms of physical problems. So all those, standard tests like X-rays and blood tests and, CTs and all that stuff is really a waste of money. So you have to really concentrate on the history. The history is really history and physical exam, right? I mean, because those are cheap. I mean, it's free, basically. If you do that and you can really get to the bottom of this, then you are saving a lot of time and money. Oftentimes, a lot of tests are done, and they're found to be completely normal. And then you sort of are left with, well, what on earth is going on? I concentrate on really trying to pick up on some key elements of the history and physical exam. Physical exam, of course, being normal most of the time. And I'll present a couple of vignettes at the end that talk a little bit more about this. So finally we get to the treatment. Now, we said that this is really a psychiatric disorder. So once you've identified that this truly is Munchausen, you would like to get some psychiatric treatment going. It's a difficult problem to solve. You want to try a non-confrontational approach to it. And the key is to recognize unnecessary tests. Alright, now let's take a look at a couple of vignettes that will kind of shed light on what's going on. So here's the first one. Alright, so the first one, emergency department because of 12-hour history of increasing dizziness and palpitations. He tells you that he knows that he is lapsing into severe hypoglycemia because of untreated insulinoma. He is an intensive care nurse at a hospital in a neighboring town, but says that he does not like doctors there, so he goes to many different area hospitals. He tells you that he has been treated for hypoglycemia on 3 separate occasions at 3 different hospitals and is too frightened to undergo surgery to remove the tumor. He tells you that he is otherwise healthy and does not take any medications. His food intake was 12 hours ago. His temperature is 37. Blood pressure is 130/90. Pulse is 11. Respirations are 18. Physical exam shows diaphoresis and pallor. This pulse is probably wrong. There's probably a 1 missing there, but no big deal. Blood glucose is 35, which is low. He has insulin levels, high insulin levels, and decreased C-peptide. You give the patient glucose-containing fluids and try to obtain his previous medical records from your hospital, but they were destroyed in a flood. You are unable to reach any of the doctors you have treated that have treated him in the past. The next step in management is... Alright, well, really quickly before I get into this, I want to talk about C-peptide. The beta cells of the pancreas produce insulin, but before they produce insulin, they actually produce proinsulin. And then what happens is the insulin molecule is then cleaved. Molecule is peptide. So if you indeed have an insulinoma, alright, that's a tumor, and that tumor is going to increase a lot of this. And if increase a lot of this, both of these will be high in a tumor. Notice in this case he has a decreased C-peptide level, which is not consistent with an insulinoma. So what's happening here? Well, the answer choices are very interesting. Consult with a surgeon for possible resection of insulinoma. Well, he most likely doesn't have an insulinoma, so I don't think it's that one. Discuss the possibility that he's producing these symptoms. Well, that's a good one. Measure the blood levels of sulfonylureas. Ooh, that's an interesting one. Sulfonylureas are medications used in diabetes. How do they work? They stimulate endogenous insulin production. Okay, so they stimulate the body's own insulin production. But we all know that insulin is produced in the form of proinsulin. And if proinsulin is produced, you'd have high C-peptide levels. This person has low C-peptide levels, so this is probably not it. Order a CT scan of the abdomen. Well, that's doing more tests, and you're kind of suspicious here. So, and CTs are expensive, so, probably not. Tell him he's malingering. That's a good choice, but remember, malingering is somebody who is faking symptoms for a secondary gain, and there's nothing in the clinical and vignette that states or even insinuates that he has any secondary gain. So when it's all said and done, the choice is B. So this is a classic vignette talking about Munchausen Syndrome. Okay? And then the final one here, 7-month-old infant is brought to the emergency department by his mother because of a 3-hour history of vomiting, abdominal distension, and general crankiness. She asks to see the surgical resident, the mother does, on call because she knows that her baby has an obstruction. She tells you that he has had 3 previous surgeries at 3 different, and the next 2 were exploratory laparoscopies with lysis of adhesions at 3 months and 4 months of age. Oh, poor baby. His temperature is 37 Celsius, blood pressure 90/60, pulse is 130, respirations are 30. His abdomen is soft and normal, and active bowel sounds. He does not wince or move as you palpate the abdomen. Rectal exam shows soft brown stool that is guaic negative. He is laughing, the child, and smiling as you perform the exam. You ask the mother why she came to this particular hospital tonight, and she says they don't know what they're doing in those other places. She then asks you if you page the surgical resident. The most appropriate next step is to. Okay. Well, let's go through these. Admit him, page the surgical resident, prepare for immediate surgery. Well, why would you do that if the child's physical exam is normal, So that's not. Draw blood for electrolytes and complete blood count. That, to be honest with you, that probably would happen, but that's going along the lines of further testing. So let's hold off on that one. Put that in brackets. Order Berry and enema. Well, again, that's further testing. Order supine and upright radiograph, X-ray of the abdomen, basically further testing. So B, C, and D are basically talking about further testing. So let's hold off on that. E makes the most sense at this point. Try to obtain a more detailed history from the mother and the physicians at the other hospital. Okay, so this is Munchausen, but it's Munchausen by proxy. Okay, there you go.